Okay, I'm back. So I know that I said I was going to come back and do a video about the drug that is called Losartan. Losartan, that's what the doctor is putting me on until my surgery next week. So I know sometimes I can be a little harsh, but I like to do things the natural way. And so for this, as I told you earlier in the previous video, I've got to take this to keep my blood pressure down, or they will cancel my knee surgery. So, but since I'm going to have to take this for a couple of days, I'm going to explain to you what is in it and the reason why I have to find something different to take after my surgery, some kind of a more healthy thing. But I'm just going to explain to you. So, what doctors do is a lot of times they will treat a symptom. Okay, so if you treat a symptom, you're only focusing on that symptom. For me, I think it's important to find out what is causing the problem. Okay, so what is it that I'm doing that is causing the problem, that's causing my body to create the symptom, which the doctors are going to want to treat is the symptom part. And I prefer to let's just treat the root of the problem so that we won't have the symptom. Okay, so the medication that he's going to give me is a symptom treater for at this point that I know of. And like I said, it's called Losartan, and I'm going to tell you what it is because there are people who are on high blood pressure medication who actually are taking it. If you hear kids in the background, hey, I am at home and I have a lot of children at home. So you just have to deal with that. Hey, but listen to this. Losartan side effects. It says Losartan can cause mild or serious side effects. The following list contains some of the key side effects that may occur while taking Losartan. This list does not include all possible side effects, so we're only going to get a few of the side effects. More of the information on the possible side effects of Losartan or tips on how to deal with a troubling side effect, talk with your doctor or your pharmacist. Okay, so the more common side effects is this: upper respiratory infections such as the common cold. Okay, so I'm going to take this for one problem, but look at the other problems that are going to stem from this: dizziness, stuffy nose, back pain, diarrhea, fatigue, low blood sugar, chest pain, high or low blood pressure. These effects may go away within a few days or a couple of weeks. If they more severe get more severe or don't go away, talk to your doctor or your pharmacist. Now here's some of the serious side effects. Those were the bottom line side effects. High potassium blood levels. Symptoms can include heart rhythm problems, muscle weakness, slow heart rate. Okay, so we have allergic reaction as well. The allergic reaction symptoms can include swelling of your face. Sorry that my lighting keeps going in and out. I don't understand why it's doing that. I'm recording from my phone this time. But anyway, allergic reaction symptoms can include swelling of your face, lips, throat, or tongue. Low blood pressure symptoms can include feeling faint or dizzy. Kidney disease. Okay, when you have high blood pressure, a lot of times your kidneys are affected. So, but they're saying for the major effects of the side effects of this, you can obtain kidney disease. Symptoms can include swelling in your feet, ankles, or hands, unexplained weight gain. So this is why just wanted to talk about it for a second. So you go in, you get treated for high blood pressure. The medication that they give you, because it's not natural, it's man-made, it's like a witch brewing in a big cauldron and making a witch's brew to give you. So to treat one symptom, there are multiple side effects that I'm going to take. Now, I'm not telling anybody not to take your blood pressure medication at all. I'm not advising anybody to do that. I'm just talking about what the side effects of this particular blood medication is. And listen, this is one of the weaker ones. So, for me, I'm going to have to find something different if my blood pressure continues to spike like that. I'm going to have to find something different to do in order to keep my blood pressure down, such as exercise. I've already been eating right. That's why we were all kind of blown away when this happened, because I haven't been eating sugar, haven't been eating any kind of meat. I can't even eat red meat. So we're not understanding why. Don't eat a lot of salt. Don't put a lot of salt on my foods whatsoever. And we actually have been doing a detox. My wife and I have been doing a detox diet called the Clean. So there'd be no reason as to why my blood pressure should be elevated like that. So we're going to try to find out the bottom of it. But I did want to give y'all an understanding of what it does, and what this medicine supposedly does is it tells your kidneys to relax and causes your blood vessels to open. So there are some that causes you to urinate, some that cause you not to urinate, some actually slows your heart rate down. Well, I got the kind of like the bottom line of what I'm supposed to be taking, and I'm only going to be taking that up until my surgery date. So I hope that gives you all some information. We do have a lot of that in our system. I have a dialysis place that's not even 3/10 of a mile from my house, and it stays packed. And high blood pressure has a lot to do with that. It has a lot to do with the people who are up there. So it's very important that we learn this. Very important that we fix what's going on in our bodies, so that we can continue having a good, healthy life. So let's continue to be wiser with our health. You all take care. Bye-bye.